Cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first.
The following programming is furnished by you and your doctor.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my friends from Florida and all around the country. Tonight we have a real exceptional show. I think it's a fabulous show because the gentleman we have on tonight, Dr. Alan Saperstein, got quite a background. If you're a sports fan, I think Dr. Saperstein did a lot of work with the New York Rangers. Am I right, Doc?
That's right.
And you also did it with the Jets?
Yep.
And now you're doing it with a lot of sports teams with FAU?
Yeah, with FAU and Lynn University.
And Lynn University? So listen, he also has an education from Harvard. And where did you go to medical school, Doc?
I was at New York University, NYU.
NYU. And he's an NYU guy over there. He raises his hand. He's an NYU guy, too. He didn't learn too much, though. Right now, Dr. Saperstein is with a group called the Boca Care Orthopedics. Am I correct?
That's right, yes.
And that phone number for Boca Care Orthopedics, please write this phone number down if you've got a pen or pencil. The phone number, correct, Doc, is 561-955-6784.
You got that.
We're going to give you that a few more times during the show. His address is 670 Glades Road, Suite 300. Doc, tell us about you. How did you start and get into medicine? Why did you get into orthopedics?
Sure. So since I was a little kid, I always liked to do things with my hands. I liked to build things. And I was a smart kid, and my parents always thought I'd be a good physician. My father was a physician, so he was a role model, which prompted me to go into medicine. But my dad was a pediatrician, and it was very clear from day one growing up that pediatrics was not going to be for me. I needed something that was very hands-on, mechanical, building things. I knew that I wanted to be a surgeon. I had a strong interest in sports, and the one field that really satisfied all those requirements, that checked all those boxes, was orthopedic surgery. It allowed you to do surgery with your hands on, allowed you to figure out complex problems, and it also provided an exposure to sports. My initial training was with a fellowship in sports medicine. After I finished my orthopedic residency, I did a sports medicine fellowship where I worked with professional teams, the New York Jets, the New York Rangers, When I came down to South Florida, I continued that, working with mostly local high school teams and developing a sports medicine practice. 10 years ago, I started working with Florida Atlantic University and their sports teams, initially with football and more recently with some of the other sports, soccer and basketball and volleyball. So I do have a very strong background in sports medicine and interest in it. But after 25 years in practice in South Florida, my patient population has aged somewhat.
Like me.
And as a result of that, I became challenged with dealing with the problems of aging athletes. And as people age, their orthopedic problems become different. Instead of having more sports medicine issues like ACL tears and meniscus tears, they morphed into more arthritic changes. So I started to develop my practice to include a large component of arthroplasty, of joint replacement. I now really have a practice that's about 50-50 sports medicine procedures, which are mostly minimally invasive arthroscopic surgeries, and 50% joint replacement surgery.
But you do a number of things. I see right here, Doc, that you got a fellowship, and you graduated, I guess, with a degree in, don't hold me, replacement surgery. You graduated with, what I don't understand what this is, magna cum laude graduate?
Yes.
From Harvard
yes.
College?
Yes, yes, I
So
do.
that shows he's pretty intelligent, right? Magna cum laude from Harvard College. And you know, one thing I don't understand, everybody comes to Florida from Boston or New York, they always say, oh, I'm not going to go with those lawyers, those doctors from Florida. I want to go back to Boston. They got the best doctors. I hear that every time from
Sure.
people I know. Let me ask you, why would you want to go? Every show that we've had on this month or last month, these folks that are practicing in Florida, you either come from Harvard, Yale, the top colleges in the country, and they're young enough to really know what's happening out there as far as what's new in the field of medicine. So there's a lot of changes since you started 25 years ago in orthopedics, isn't there?
Yeah, there certainly have been quite a few changes. You know, it's funny, just echoing what you just brought up. I remember when I told people I was moving down to Florida from New York to start an orthopedic practice, I remember somebody said to me, you know, Doc, you know who the best doctor is in South Florida? I said, no, who is it? Delta Airlines. He said, so. And I think that was really a mindset many years ago. But I think now people are starting to realize that the doctors who are practicing down here all trained in major centers of excellence in medicine, in all the fields. And I think really South Florida provides the same quality of medical care that you can get in New York or in a Boston or in a Chicago.
I totally agree with you. I think we have some of the smartest young men that are coming to Florida right now and practicing medicine. That's especially now they know they're coming with an older population. They know the people are going to be needing care. So this Dr. Saperstein, remember, he's familiar with the young athlete, the guy that wants to go out there and play football or play tennis, play golf, whatever it is, and the older athlete, like myself, wants to play golf but gets hurt along the way. It says, Doc, I want to get back out there and play golf. What do I have to do? So when you now, how do you see these patients? Are they calling you basically for an appointment? Do you take, what kind of insurances do you take?
Yeah, no, I take most insurances. Certainly, there's always going to be a few exceptions, but most patients should be able to get in to see me.
You can get it to see you.
Yeah, no, that shouldn't be a problem. And of course, people call, make an appointment. I see all variety of orthopedic issues, but really the things I see the most of are shoulder problems, knee problems, and hip problems. I mean, that really constitutes probably 85% of the patients that I see, with the occasional ankle or elbow thrown in here and there. Some of the patients I see are injuries, an acute injury, playing a sport, twisting your knee, and it swells up and is painful. Some are more chronic issues where people just have had a nagging, aching pain that's been gradually worsening over time, whether it's a shoulder or a knee or a hip for that matter.
What are some of the cases you treat? I know you treat torn meniscus. You treat basically bone-on-bone surgery. I'm talking about knee and hip.
Yeah, so again, if we sort of look at most problems that I treat as an orthopedic surgeon involve the joints. Obviously, fractures involve the bones in between the joints, but really most of what I see is joint problems. In the sports medicine arena, we're seeing tears of structures in the joints. We're seeing ligament tears. In the knee, it might be an ACL, an anterior cruciate ligament, or a PCL, a posterior cruciate ligament. We also see injuries to other soft tissue structures in the knee, the menisci, as you mentioned. You can have a meniscus tear, and that can be the result of a trauma, or that can be the result of wear and tear. In the shoulder, a common injury I'll see is a rotator cuff tear, which is a tendon injury, but again, a soft tissue injury that can be the result of trauma or can be the result of overuse. Those are some of the most common sports medicine conditions I'll treat. From a joint, an arthroplasty perspective, the main disorder that we treat is arthritis. Just from overuse over many years, as patients get older, their cartilage starts to wear out. Their joint surface becomes thinned out, and the underlying bone starts to rub against the underlying bone. And that's basically painful and restricts motion.
What is arthritis basically when you say the hip and the knee? What is it? What causes that?
So that's an excellent question, and we don't really know 100% at this point. There is strong evidence that there is a significant genetic basis to it. So there are genes that are being identified that increase the propensity, the likelihood that one's going to get arthritis, but there's no one overall root cause. Some patients get it because of an injury. If you tear your ACL when you're 25 years old, there's a pretty high likelihood that 20, 30 years later you're going to have an arthritic knee. But the vast majority of patients who get arthritis, they just get it, and we don't know why.
Yeah, no reason. And what are some of the treatments? Say somebody came to you with a torn meniscus or what they call bone on bone. How would you treat that? Would you treat that arthroscopically? Would you treat it with a full knee? Or you also, I read, did some partial replacements too.
Yeah, so there's a lot of different treatment a lot of different treatment modalities out there for patients with knee injuries. We always try to be as conservative as possible with initial treatment, activity modification, injections, anti-inflammatory medications. But from a surgical perspective, we have many modalities as well. The simplest thing is arthroscopic surgery, which is minimally invasive surgery. We make 2 or 3 holes around a joint, look inside with a fiber optic camera and assess the damage and correct what we can correct. We can correct meniscus tears arthroscopically. We can repair some meniscus tears, and we can remove pieces of meniscus in other types of tears. When it comes to arthritis, we can do a little bit of work arthroscopically to help the situation. We can debride a little bit of the loose tissue, but we can't really cure arthritis with the arthroscope. When it comes to really a surgical correction for arthritis, our mainstay is joint replacement surgery. Sometimes we replace the entire joint. That's a total joint replacement, a total knee replacement in the case of a knee. Sometimes we replace a portion of the joint that's worn out if the rest of the joint looks good, and that's a partial joint replacement.
So the question I'm asking right now is, if you're listening to us and you look at this gentleman's resume, how many people had a chance to work with the New York Rangers, the Jets? Now, these are professional athletes making a lot of money.
Yes.
And that team, as a matter of fact, they just happened to be with Dale Talon, who happens to be the GM of the Florida Panthers. These folks are making a lot of money. And they want the best physician to make sure that player is back on the ice or back on the field as soon as possible. Because, they don't want him out for the season. So if this gentleman is just Dr. Saperstein is working with these teams, he's got to be pretty good. So let me tell you this. If you're right now thinking of getting a knee surgery, a hip surgery, a shoulder surgery, come and see him. At least get a second opinion. Get a first opinion. And if you like what he says, follow through what he says, because I think he has the cure. At least to try to help you, or anyway, he'll tell you what's wrong or not wrong. As I said, there's not too many people with these credentials. And right now, we might have to take a little break. Freddie, do we have to take a little break? Let's take a little 30-second break. We'll be back with Dr. Alan Saperstein in a few seconds. Thank you.
Thanks.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Okay, we're back with our great guest, Dr. Alan Saperstein, who has a great resume. I wish I could put it online, but if you want to talk to him, please call him at this number, 561-955-6784. That again is 561-955-6784, or you can call us at All County Healthcare at 954-717-7027, and we're happy to give you his phone number so you can set up an appointment. I'm sure he'll be happy to get in to see you. Again, Dr. Saperstein is telling us about the different types of surgery that he can perform. I guess some is partial, some is full. Am I correct, Doc?
For joint replacements, yes. Especially in the knee, we see many patients who the arthritis affects only a portion of the knee, and their partial knee replacement can be as effective as doing a total knee replacement.
You know, most people always say to me, you know, I've had a torn meniscus, 2 of them, for about 7 years, and I was very negligent. Should have got it done 7 years ago. But I don't realize, you can't realize, I played ball, you can't realize the pain that you're in and how it affects you. I mean, the pain just affects you, constantly pain, no matter what you do. I've taken stem cells, I've taken everything you think of, and nothing works. So right now I'm going to commit myself to do some kind of surgery, whether it's partial, full, or whatever they tell me they need. But, you know, and I'm going to talk to Dr. Saperstein about this because I think he's very knowledgeable and really will tell you the truth of what you basically need. Again, tell us more about primarily the injuries that you see in older people. One of the things, I'm a golfer, and I say, well, how long does it take me to heal? Somebody, oh, you're up and walking the next day, or you're up and doing this the next day. Be honest, how long does it take you to heal an older person?
So, well, it depends on a lot of factors. Depends on, first of all, what kind of surgery we're talking about doing. Everything has some things take longer than others. But it depends a lot on the patient as well. Mm-hmm. I mean, I can do the same surgery on 2 different patients on the same day, and one patient may fly through his recovery and you'd be all better in 2 or 3 weeks, and one patient may be struggling and 2 or 3 months later is still not where he needs to be. So there really is a bell-shaped curve in terms of how people recover from injury.
So what is some of the recovery process? You do the surgery. What's his next step he has to do?
So for most surgeries, the most important aspect of postoperative care is physical therapy. For most joint surgeries, particularly joint replacements, but also things like rotator cuff repairs, mobilization of the joint is critical. With weight-bearing joints, we always have step 1 is getting the patient walking again, getting weight on the joint. Step 2, and these aren't really sequential but more occurring concurrently, but goal 2 is getting range of motion to the joint, and then goal 3 is strengthening to the joint.
And one of the things we like to make a plug for All County Healthcare, we specialize with a lot of orthopedic doctors in doing physical therapy on both the knees and the hips. Matter of fact, we give our patients, we give them a patient handbook, which is assigned to you, which even defines to them, which I think is very important, is about fall prevention. Because you don't want your patients to fall once they get home.
Right, that's absolutely true, and people don't realize that, after surgery, immediately after surgery, there are a lot of reasons they might fall. First of all, they may be taking pain medications. There's recent exposure to anesthesia. And these are things that may impair their balance and their ability to walk smoothly. And it's not uncommon that people can lose balance and fall. So it is critical that people be aware of that risk and take the appropriate precautions to prevent it.
One of the things we do, I'll give a plug, one of the things we do with all our doctors, we go in and do a full home assessment. If they got carpeting in there that's slippery and can't move, we move the carpeting. If they need rails, we recommend they take rails in the shower or the bed. So fall prevention is very, very important, I think, after you have surgery, especially as you get older. And one of the things I think a lot of it, a friend of mine had surgery, and getting out of bed, he got out too quickly, and he fell and hit his head. So the idea thing is they will explain to you how important it is to try to prevent you from falling when you get out of the hospital. And if you go home, to get to home care, or you go into rehab, etc. So some of the docs will send them to rehab, then home care, or whatever the procedure is. Some people don't want to go to rehab, they want to do home care at home, so we do all of that. Now, one of the other things I was looking at, if I may say, Doc, is that you're with the Boca Care Orthopedics.
Yes, that's right.
And Boca Care Orthopedics is part of the Boca Raton Hospital, Beverly Down Baptist.
Yes, that's correct.
It's called Baptist now, correct?
Well, the hospital is still Boca Raton Regional Hospital, but Baptist Health South Florida is now overseeing that hospital and managing it, and managing Boca Care as a practice as well.
So when you see these patients, if there's something else wrong, do you have a referral system where you refer them to somebody else for some other problem I find?
Oh, sure, yeah. I mean, many of my patients have complex medical histories and require the services of other physicians or other ancillary health services. Most of my patients come with a battery of physicians already, a team already, but certainly when people don't have somebody and have a need for another specialty, certainly a lot of people have confidence in that I refer to routinely.
Some people have atrial fibrillation, and they're on Eliquis.
Yes.
And one of the questions was, can I get surgery when I'm on Eliquis? Well, I talked to a physician, I talked to a cardiologist, he says, yes, we'll keep you off Eliquis for a few days, but immediately after surgery, you put back on. So if one of the things after knee and hip surgery, they want to go on a blood thinner. Am I correct?
Yes.
If you need to?
So we usually, actually, patients who aren't on a blood thinner, usually when we do joint replacement surgery, because there is a risk of blood clots after that surgery, we will put them temporarily on a blood thinner, perhaps Eliquis may be an example.
Right.
But there are others that we use. Patients who are already on blood thinners, while we'll have them back on their blood thinner after surgery, we do want them off right before surgery,
Right.
So that we don't have bleeding issues during surgery. We usually check with their cardiologist to find out if it's reasonable to take them off the anticoagulant. Sometimes they need to be on a short-term anticoagulant. And again, this is at the discretion of the cardiologist or internist. Sometimes they need a short-term blood thinner while they're off the Eliquis and waiting for the surgery. But they do have to be off all blood thinners before major orthopedic surgeries.
What are some of the things that you've seen, Doc, in your history of practicing medicine? They talk about an ACL tear.
Sure.
What is an ACL tear for the younger people?
Oh, sure. Anterior cruciate ligament is one of the major ligaments in the knee. It's the second most commonly injured ligament in the knee after the medial collateral, or MCL, ligament. It's typically the result of a non-contact injury. About 2/3 occur without contact. Typically, a twisting injury is the most common, but it can occur with hyperextension of the knee, and it can occur with contact. We see it a lot in young athletes. Occasionally, we see it in older athletes as well. An ACL is a critical ligament to stabilize the knee. Once it tears, it doesn't heal. Unlike the MCL that I mentioned earlier, it stays torn. As a result, the knee is unstable after an ACL tear. We used to call that a trick knee when I was a kid in the 70s and 80s. Nobody uses that term anymore, but that's what it was. For most athletes, when they tear their ACL, they reconstruct the ligament. They rebuild the ACL. We rebuild the ACL to give the knee good stability. It's become a very common procedure over the past 30 years, and patients usually do very well, and patients usually get back to their pre-injury sports. But it certainly is a very popular surgery that is very well known and to just about everybody these days, I think.
You hear a lot of it. You hear these athletes, oh, you suffered an ACL tear, you'll be out for the season. So they usually out for a long period of time?
So it's always a season ender. Really, no one comes back and plays that season in any sport with a torn ACL. After surgery, we used to say it was a 6-month recovery to return to sports. And I think in recent years we've come to realize that that is a best case scenario for the select few who really are able to fly through all stages. Probably more realistically, we should say a 6 to 9 month return to sports. Because not only do you have to get the knee moving well again and strong, you have to work on the patient's proprioception. They have to start to feel their knee in space. And for these real aggressive athletes, that's not such an easy feat to achieve. So there really is a lot of rehabilitation, even after the traditional first stage physical therapy is over, to get them back to their specific sports is often another 2 or 3 months of training.
One of the things I found out also in my situation is people always say knee braces, use a knee brace. Some of the physicians I talked to said don't use a knee brace. So the factor is I got a special knee brace, specially ordered, and my injury got worse if I used a knee brace.
Yeah. Well,
Explain that.
like anything else, it depends on the condition you're treating. Braces are generally used for ligament injuries, for unstable knees because they don't have the proper ligaments that are functioning. They're not great substitutes for ligaments, but they at least provide some support. More common injuries that particularly older, middle-aged and older patients have are arthritic problems with the knee, and their braces don't really do a whole lot. The knees are not unstable. The knees are stiff and arthritic, and bracing really doesn't offer a whole lot in that type of patient.
At what stage, I got 1 minute? I've got 1 minute left.
Okay.
At what stage does a patient should come to you when he thinks he suffered an ACL tear? Me, I waited a long time. You think it's important he comes right away when he feels this type of pain?
So the type of injury that causes an ACL tear is usually a pretty significant injury. You feel a pop. The knee is quite painful. It's difficult to put weight on the leg right away. It swells up relatively quickly. If you have any or more than one of those symptoms, I would definitely make an appointment with me or any other orthopedic surgeon to get checked out.
Well, come to that. Let's tell the audience where to get a hold of you again. Remember, Dr. Alan Saperstein, been around Boca Raton for 25, 30 years?
25.
25 years. And his phone number is 561-955-6784. That's 561-955-6784. Doc, thanks for coming on. You're welcome anytime. Please come back and see us.
It's been a pleasure. Thank you for having me.
Thank you.
A longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier